Do you know that approximately 96 million American adults have prediabetes? Of this population, 80% do not know any basic symptoms that may cause this condition. According to the Lancet Journal, it is projected that more than 470 million people will have prediabetes in 2030. If you want to avoid being part of this statistic, I have one question for you. When was the last time you checked your blood glucose level? Well, if you have recently, and your fasting blood glucose levels are less than 70 milligrams per deciliter, then you have nothing to worry about. But if it falls between 100 and 125 milligrams per deciliter, then you are in the pre-diabetic range. Anything above 125 means that you are already diabetic and urgently need to see your doctor. Although genetics and lifestyle play a role in increasing your risk of developing prediabetes, it can generally affect both adults and kids. But before prediabetes turns into a full-blown type 2 diabetes, your body sends some warning signs, which is why I want to talk about them first. In this video, we will be discussing the warning signs and symptoms of prediabetes that you should look out for. Is frequent urination one of the signs? What about numbness in the feet and arms? Can prediabetes affect my vision? Well, yes, and we will talk about all that and more. Number 1. Frequent urination. Do you feel the urge to urinate literally every hour? If you do, this might be your body trying to tell you that your blood sugar level is high. But why does an elevated blood sugar level trigger frequent urination? Well, the answer is simple. The glucose going to the kidneys is more than they can reabsorb, so the excess glucose needs to be removed. Then, glucose does not pass through urine on its own. It needs a carrier to help it get out of the body. Water does just that. Basically, the kidneys try to filter the glucose out of the blood into the urine. And that leads to increased urine production, frequent urination, and a sense of urgency to urinate. This symptom is what doctors refer to as polyuria. Meanwhile, the vicious cycle of producing large volumes of urine and frequent urination could put you at risk of developing urinary tract infections. Number 2. Excessive thirst. Apart from the frequent urination, have you been spending a lot of time at the water cooler? Do you feel parched even after taking all the fluids and all the drinks? Well, your insatiable thirst could be because of high glucose levels. Since the kidney produces more urine, the body is prone to dehydration. And due to the fact that your blood glucose levels are high and supersaturated with sugar, your body tries to dilute them with more fluid. This triggers the excessive feeling of thirst you experience. In addition to the insatiable thirst, you may have a dry mouth and tongue that's difficult to get rid of. Doctors call this condition polydipsia. Number 3. Blurry vision. Have you been having problems with your vision, or was it getting worse recently? Most cases of temporary blurry vision are as a result of increased blood glucose levels. This is because high glucose levels pull fluid from your tissues, including the lenses of your eyes, and this affects your ability to focus. If nothing is done about it fast enough, the blood vessels and the retina become affected. This is what is also known as diabetes retinopathy. Studies have shown that nearly 8% of people develop pre-diabetic retinopathy during the pre-diabetic stage before they have been officially diagnosed with diabetes. So try and get your blood sugar back to the target range before it becomes too late. Before we continue, be more intentional about your health by clicking the subscribe button and ringing the notification bell so you will be the first to know when we upload health-related content like this one. Now let's move on with our list of most common signs and symptoms of pre-diabetes. Number 4. Increase in hunger. Excessive hunger, also known as polyphagia, is another warning sign of pre-diabetes you should know about. If you have noticed that you feel famished even after having a big meal, you should not hesitate to check your glucose levels. It is a well-known fact that glucose is converted into energy in the body. However, when the body is suffering from prediabetes, the body becomes insulin resistant. In other words, the cells of the body can't take up glucose from food. And as sadly as it sounds, no glucose means no energy. Since the muscles and organs are weak, your brain will always signal that you are hungry. And that's why you feel hungry all the time and eat more than what you would have eaten on a normal day. Number 5. Skin coloration. This sign of prediabetes can come in the form of thick, velvety patches in areas like your knees, elbows, neck, armpits, and knuckles. This condition is medically known as acanthosis nigricans. However, it shouldn't be confused with skin conditions like skin tan or brown skin, which go away after you scrub them. Acanthosis nigricans don't go away unless the underlying cause is treated, and in this case, it is prediabetes. The affected areas of your skin may also itch or have an odor, so always check your skin folds and groin to know when your body is warning you of prediabetes. Number 6. Prolonged healing of wounds. Do you know that high sugar levels can impair the function of your body's clotting system? According to a study published by the National Library of Medicine, high glucose levels in the body cause slower circulation, microvascular dysfunction, and reduced tissue oxygenation. This means that it takes longer for the blood-carrying clotting factors and platelets that help stop bleeding and heal the wound to reach the site of injury. Yep, so if bruises and cuts are taking forever to heal, it could be the case that it is really a sign that you're pre-diabetic. Run a blood test and start treatment immediately if pre-diabetes is confirmed. Also, try to check with a medical professional to understand this condition better. And number 7. Numbness and tingling sensation. Excessive sugar in the blood spells trouble to your nervous system, and your arms and feet also bear the brunt of a high blood sugar level. So keep an eye on signs like tingling, numbness, or burning in your extremities, as this might be another pre-diabetes symptom. Some experts claim that this is medically identified as diabetic neuropathy. The severity of this condition depends on the affected nerve. However, if nothing is done as soon as possible, you might be at risk of developing a serious infection or gangrene. Well, it doesn't end there. You might also be at risk of having ulcers, or even worse, losing your foot. I know you don't want that, so make sure you keep your blood sugar level in the right range. Prediabetes is a condition where your blood sugar is higher than normal, but it is not high enough to be type 2 diabetes. It is a phase before you become diabetic, and it can go undetected for years. That is why early detection is very important in order to prevent severe complications that might come in the long run. As alarming as it may sound, there are many ways you could avoid experiencing such pre-diabetic signs and symptoms. One is by frequently checking in with your local doctor and see how your body is getting on. Another very useful option is to have a well-balanced diet, and there are a couple of ways you can actually do it. If you want to learn more about how to take care of your health, I suggest you watch this video on the top foods that help to lower creatinine levels, or if you can find out more about the benefits of CoQ10 and why the supplement should be used on a daily basis.